Welcome to What is CIDP, presented by Hizentra featuring Dr. Jeffrey Allen. Dr. Allen is an associate professor in the Department of Neurology at the University of Minnesota.
It's a real pleasure and honor to be here and to talk a little bit about CIDP and some of the treatment options we have for CIDP. So what is CIDP? Well, it's a disorder of the nervous system, and specifically the peripheral nervous system. So this means the nerves in the arms and the legs. So it typically doesn't affect the brain, the spinal cord. It doesn't affect other organs in the body. It just really focuses on the arms and legs. And it's an autoimmune problem. So the immune system is obviously very important to keep us healthy, to fight off infections. But sometimes that immune system can get a little bit confused. And for CIDP, it gets confused because it goes and starts to attack the peripheral nerves. And usually it attacks a specific part of the peripheral nerve called the myelin. The myelin is this insulating sheath that wraps around the axon or the wire of the nerve. And when that myelin is disrupted, it prevents the signal from being carried down the nerve to wherever it's supposed to go. And when that happens, the symptoms of CIDP can develop. And those symptoms can be variable. The disease affects different people in different ways. But invariably, two of the main symptoms that happen are numbness and weakness. So people can get numb and weak. It can affect different people in different parts of their body, but usually the left side of the body is similarly affected to the right. Often the arms and the legs are both affected. And it usually affects the parts down farthest in the hands and feet, but also can affect the parts of the body that are a little farther up, including in the hips and farther up in the arms as well. When this happens, it can lead to things like difficulty walking, trouble with balance, difficulty using your hands, especially for kind of fine motor tasks. And this can lead to a lot of disruption and a lot of personal and professional tasks and create a lot of the disability that comes with CIDP. Now, CIDP evolves over a period of time, and we kind of think about this disease as evolving over 8 weeks or more, and that can be in a kind of a progressive course or a relapsing course. And for many people, the evolution is much, much longer than that. And one of our objectives, our goals, is to intervene and treat before some of the more permanent nerve injuries occur, which happen fairly frequent in the disease.
Important safety information. Warning. Thrombosis, blood clots, can occur with immune globulin products, including Hizentra. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Hizentra, immune globulin subcutaneous, human, 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. See full prescribing information, including boxed warning, as well as important safety information at the end of this video or at hizentra.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.
So from a treatment perspective, there are things we know are effective and that work for CIDP. And the things we know work are corticosteroids, plasma exchange, and immunoglobulin therapies. So all of these have been proven effective. So corticosteroids are similar to naturally occurring anti-inflammatory hormones in the body. We can take them in pill form, orally, or IV. They're very widely available. They're fairly easy to use. And they're fairly inexpensive as well. So many side effects that go along with corticosteroids, but it's one very effective, important treatment option for CIDP. Plasma exchange, we also know works. Plasma exchange is a process whereby the blood is removed from the body, the blood cells are separated from the plasma is discarded, and then this plasma from healthy donors is replaced. And we think that that's a helpful way to kind of remove some of the antibodies that we think cause the problem in CIDP. And that can be an effective treatment, although also has many of its own limitations. And the third thing we know works is immunoglobulins. Immunoglobulins are a collection of proteins. Everybody has them. Some of these proteins are antibody. And by collecting a lot of these proteins from many, many healthy blood donors and pooling those proteins together they can be re-administered back to a patient with CIDP, and that is known to be effective and helpful treatment. And we think that works for a number of different ways. It seems to neutralize or increase the clearance of some of these antibodies that we think cause the problem in CIDP. So a number of those are the three pillars of treatment for CIDP. Now, immunoglobulin kind of comes in two different flavors: intravenous immunoglobulin and subcutaneous immunoglobulin. It's essentially the same drug, but just the route of administration is different. In IVIG, it's administered through a vein intravenously. So patients are typically given fairly large doses of IVIG administered at some set interval. It's often about 3 weeks, although that can be quite variable. Obviously, if you're getting the IVIG, you need somebody, a trained healthcare professional, to provide that to you, either at an infusion center or somebody traveling to you to come and get it. Subcutaneous IG is a little bit different. Again, it's the same drug, but instead of going to the intravenous route, it goes through the subcutaneous route. So basically into your fat. There are advantages and disadvantages of IVIG and subcutaneous IG, but essentially subcutaneous IG is a smaller amount of immunoglobulin, but it's administered more frequently through the subcutaneous tissue. And that has potential advantages and disadvantages to it. So the question next is, does subcutaneous work? So the data on IVIG is fairly convincing. It's very convincing, actually. It's been studied in multiple trials, and we know that IVIG is very effective for the treatment of CIDP. There was a large clinical trial that had studied subcutaneous IG for maintenance treatment for CIDP, and it was found that patients that were randomized to the drug less often relapsed or withdrew from the study compared to those that were randomized to placebo. It also showed that patients that were treated with subcutaneous IG were able to maintain their strength in their arms and legs as well as their disability compared to those that were in placebo. So the study clearly showed that this subcutaneous IG was an effective treatment option for maintenance therapy for CIDP. Most patients, 93% actually, were able to get the infusions without any side effects at all. Now, there were some side effects, but subcutaneous IG, like IVIG, is still immunoglobulin. So all of the side effects that are potentially a problem with IVIG still apply to subcutaneous IG.
Important safety information. Hizentra is made from human blood. The risk of transmission of infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease, CJD agent, and its variant, VCJD, cannot be completely eliminated. The most common side effects in the clinical trials for Hizentra include redness, swelling, itching and/or bruising at the infusion site, headache, chest, joint, or back pain, diarrhea, tiredness, cough, rash, itching, fever, nausea, and vomiting. These are not the only side effects possible. Tell your doctor about any side effect that bothers you or does not go away. Before receiving any vaccine, tell immunizing physician if you have had recent therapy with Hizentra, as effectiveness of the vaccine could be compromised. See full prescribing information, including boxed warning, as well as important safety information at the end of this video or at hizentra.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.
However, the frequency of some of these side effects was less. So in IVIG, some of the more common limiting side effects are things like headache and nausea. And while those things still happen with subcutaneous IG, the frequency of them seems to be less common with subcutaneous compared to IVIG. In the clinical trial of subcutaneous IG, the most common side effects included things like redness, swelling, itching, bruising, headaches, joint, chest, and back pain, as well as a couple other things. And it's important to talk to your doctor if any of these side effects happen.
Thank you for joining us today to learn about living with and treating CIDP. If you have CIDP and are interested in the convenience of self-infusing your treatment on a schedule built around your lifestyle, talk to your doctor about Hizentra today. Important safety information. Warning: thrombosis, blood clots, can occur with immune globulin products, including Hizentra. Risk factors can include advanced age, prolonged immobilization, a history of blood clotting or hyperviscosity, blood thickness, use of estrogens, installed vascular catheters, and cardiovascular risk factors. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Hizentra, immune globulin subcutaneous, human, 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Treatment with Hizentra might not be possible if your doctor determines you have hyperprolinemia, too much proline in the blood, or are IgA deficient with antibodies to IgA and a history of hypersensitivity. Tell your doctor if you have previously had a severe allergic reaction, including anaphylaxis, to the administration of human immune globulin. Tell your doctor right away, or go to the emergency room if you have hives, trouble breathing, wheezing, dizziness, or fainting. These could be signs of a bad allergic reaction. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. Inform your physician if you are pregnant or nursing or plan to become pregnant. Infuse Hizentra under your skin only. Do not inject into a blood vessel. Self-administer Hizentra only after having been taught to do so by your doctor or other healthcare professional and having received dosing instructions for treating your condition. Immediately report to your physician any of the following symptoms, which could be signs of serious adverse reactions to Hizentra: reduced urination, sudden weight gain, or swelling in your legs, possible signs of a kidney problem, pain and/or swelling or discoloration of an arm or leg, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, unexplained rapid pulse, or numbness or weakness on one side of the body, possible signs of a blood clot, bad headache with nausea, vomiting, stiff neck, fever, and sensitivity to light, possible signs of meningitis, brown or red urine, rapid heart rate, yellowing of the skin or eyes, chest pains or breathing trouble, fever over 100 degrees Fahrenheit, possible symptoms of other conditions that require prompt treatment. Hizentra is made from human blood. The risk of transmission of infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease, CJD agent, and its variant, VCJD, cannot be completely eliminated. The most common side effects in the clinical trials for Hizentra include redness, swelling, itching and/or bruising at the infusion site, headache, chest, joint, or back pain, diarrhea, tiredness, cough, rash, itching, fever, nausea, and vomiting. These are not the only side effects possible. Tell your doctor about any side effect that bothers you or does not go away. Before receiving any vaccine, tell immunizing physician if you have had recent therapy with Hizentra, as effectiveness of the vaccine could be compromised. Please see full prescribing information for Hizentra, including boxed warning and the patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.